I'm now going to demonstrate suctioning a trach. I have a 14 size suction catheter, which we'll use for the mannequins. You can use 14 or 16 is the usual size in the hospital setting. I have some normal saline. I've got a clean pair of gloves. I come in and assess the patient. I've washed my hands, and I notice that he's got some bronchi when I listen to his lung sounds. His pulse ox is maybe a little bit low, 89 to 90%. I notice his breathing is labored. He might be clutching at his trach, indicating that he needs to be suctioned. And I may even see that he's got some mucus coming out of his trach. So I put the side rail down and put the bed up a little bit. And I'm going to put on my clean gloves so that I can take that trach mask off. And I'm just going to lay that on his chest. And I'm going to grab an ambu bag. There's two things I want to do prior to suctioning. First, I want to hyperventilate the patient. So I want to, just like taking a few deep breaths to make his cough more productive. And I also want to hyperoxygenate the patient, because when I suction him, I'm going to deplete oxygen as I suction out with a catheter. So I've cooked this to oxygen and turned it up to 100%. Put that on the patient, and I'm going to give him a deep breath as he's inhaling. And I'm just going to leave the ambu bag right there while I prepare the suction catheter. He can still breathe with that bag on. I'm going to remove my gloves now and get my suction catheter kit ready, because this is a sterile procedure. There's a box on the outside of the suction catheter. I'm going to take that box out, and then it's a pop-up, so you just pop it open, not touching the inside because you want to keep that sterile. And then we're going to put saline in there, and that's to flush the catheter with. So my saline, see that it's not expired. I'm going to lip it and pour some saline in there. Give that patient another breath. And open up my kit, and the first thing I see is a pair of sterile gloves, so I'm going to apply those. And then while I have two sterile hands, I'm going to get my catheter prepared. Here's my suction catheter. And I'm going to always keep your dominant hand sterile. So I'm going to wrap this up into my dominant hand. Give the patient another breath. And then I'm going to take my suction catheter. I've already turned it up to medium. Just close it off and make sure it does just go up to medium before you suction the patient. And I see that it's okay. So I've contaminated this hand, and this will be my sterile hand. So I'm going to hook the suction catheter to the long tube going to the suction canister. And then this will be a clean area and a sterile area. Now, you'll see there's a hole there. If I close that hole, it's going to create suction, and that's how I want to insert it into the patient, without suction, I should say, not with suction. That's how I want to suction out the patient. So I want to test the tube prior to using it and lubricate the tip. So I'm going to put this in saline, cover up the hole, and I see you can hear that it's working. So I'm all ready to suction the patient. I'm going to wrap that back up in my hand, and I want to give him one more breath before I suction him. I'm going to take my finger, index finger, place it on the faceplate, and then pull with the rest of my fingers the ambu bag off the patient. And as I said, I'm going to insert this without suction until you feel a little bit of resistance, and the patient will probably gag at that point. So pull back, and then I'm going to intermittently suction, and then in a circular motion pull this through my hand until I'm at the top of the trach, and I'm going to wrap that back up so I can hang on to it one-handedly and give the patient a breath. And then I would reassess if I needed to go down again with the catheter. If the patient still had bronchi, he was still coughing, or seemed like there was more mucus there. So we're going to say that the patient is clear. So I'm going to flush the catheter. get rid of the catheter. Basically, I'm flushing this tube, because this one I'm gonna throw away. Put that up there. Turn that off. I'm gonna give the patient one more breath. Remove the ambu bag, and then I would replace the trach mask. Has a little snap on the side. Okay, that's it for suctioning a patient via trach.